Hi, my name is David Abafi, and I'm doing this video to talk about my project work through the course of my practicum at the Institute for Women's Health. I worked on neglected tropical diseases and how they affect maternal and child health. By way of introduction, neglected tropical diseases are diseases that thrive in underdeveloped areas in the tropical parts of the world, impacting over 1 billion people globally with severe morbidity and mortality. Now, these diseases are most common in remote regions with limited health care, clean water, and sanitation. And people in Africa, in Asia, in parts of America, especially the southern parts of America, are affected. These neglected tropical diseases bring about malformations, impairments, and death, and they are even worsened by poverty and inadequate infrastructure. Addressing these diseases requires a multifaceted approach, which will include socioeconomic empowerment, improved living conditions, and healthcare access to better healthcare. Now, the WHO originally listed about 17 of these diseases, but later expanded it to 20, caused by various infectious agents, highlighting the need for comprehensive interventions. Gender-based inequalities in low and middle income countries hinder women's development through abuse, early marriage, and restricted opportunities, which are based on cultural values and norms. Neglected tropical diseases impact both genders, influenced by biological complexity and cultural norms. Specific examples of these neglected tropical diseases that affect women and children in these developing countries are female genital schistosomiasis, which is a parasitic infection which is spread through contaminated water when people have contact with it, and is gender specific with severe consequences, causing anemia, stunted growth, and learning disabilities in children. Trachoma is a chronic eye infection that can lead to blindness. It affects an estimated 253 million people worldwide, caused by chlamydia trachomitis, and is spread through contact with infected eye secretions. And it's sad to say that women are more infected. Lymphatic filariasis is also another infection caused by parasites that can cause elephantiasis, which is a condition in which the limbs swell, and it is spread through mosquito bites, especially in these developing countries. Onchocerciasis is also another infection which can cause skin lesions and blindness, and it is spread through the bite of the black fly. Women are responsible for caring for the sick and elderly. They may have less access to clean water and sanitation. They may have less time to seek medical care. They may be less likely to seek treatment for these kinds of diseases because of cultural norms and societal values, in quotes. Children are affected by these diseases, especially like malaria, which hinders education and perpetuates cycles of poverty and illness. Sadly, adolescent girls face unique risks due to reproductive vulnerabilities as a result of these kinds of diseases. Now, there's the need to bring about intervention, and these interventions can bring about improved well-being, reduced mortality, strengthened healthcare systems, effective treatments for these diseases, which will lower the disease burden, benefit women and children, improve the outcome of pregnant women, and develop better initiatives for child health. So for this project, for this research, for this study, I had specific SMART objectives. I had 4 of them. The first was, by the end of the practicum, I would be able to apply cultural values and practices to the design of public health programs and policy recommendations in these developing countries, which will be measured by grant sections approved by the preceptor. The second SMART objective I had was, by the end of this practicum, The student developed a comprehensive log which compared health systems across various countries to evaluate women's health among the population of women in the world. By the end of the practicum, a third SMART objective, the student will be able to evaluate best practices for programs, projects in terms of their quality, effectiveness, and efficiency using qualitative and quantitative methods within a research grant. And the last SMART objective is by the end of this practicum, the student will have been able to describe effective measures and evaluate policies for the impact of health of women and health equity in various countries, which will be measured by the development of a needs assessment. So, talking about this whole research, the methods to carry out this research, I engaged in thorough literature review, and it focused on neglected tropical diseases in low and middle income countries. Recent peer reviewed articles from 2018 to 2023 were examined. Consulting reputable journals like BMC, infectious disease, plus neglected tropical diseases, and more. Specific search terms were used to find relevant articles about these diseases in women and children, and some of the references were excluded based on inclusion criteria. Valuable insights about these diseases in sub-Saharan Africa were obtained from various sources, also including the Journal for Environmental Research and Public Health, Lancet, Infectious Diseases, PubMed, government websites like the United Nations SDG and USAID. We went ahead to develop needs assessments, and the needs assessment survey was conducted mainly to understand the level of knowledge about MTDs among medical experts, the awareness of these diseases among public health authorities, and the need for the treatment of neglected tropical diseases. The survey was conducted using Google Docs, and the results were used to update the library of the International Institute for Women's Health with profiles of women and children in different countries. The survey also was a successful way to engage healthcare experts and gather valuable insights and improve the database of the Institute for Women's Health and provide a better understanding of the dynamics affecting global health. The survey also helped to identify the best intervention methods to help address these diseases. By carefully considering the needs of the target population, which are women and children, the Institute for Women's Health was able to develop interventions that were specifically designed to be effective. The successful completion of this needs assessment was an important step in the right direction in the fight against neglected tropical diseases, and it has helped to raise the awareness of these diseases and open the door to strategic actions that will improve global health. It was deemed fit that the findings from this research will target a broad audience and be disseminated to engage governmental, non-governmental stakeholders and empower countries for effective implementation and transform research into actionable efforts, enhancing health and outcomes practically. The results of this research have been talked about in the whole study. We had the Prisma workflow diagram, which is in the appendix part of the research, which shows a detailed selection process of how we got the articles, the search terms that were used for specific NTDs, the topics covered, the impacts on women and children, and the comprehensive and methodical literature review process, providing foundation for further research into these diseases and their impact on vulnerable populations. We also had a comprehensive log which showed the progress of the research on neglected tropical diseases that affect women and children, their health, the objectives, the actions taken, the strategies for prevention, diagnosis, and treatment as outlined within the grant proposal, which was sent to the governmental organizations. The log also provides a detailed record of research activities that were carried out, the results that were obtained, and the challenges that were faced, also providing a summary of the strategies that have been put in place to prevent, to diagnose, and also treat these neglected tropical diseases. Now, this log is an important tool for tracking the progress of research, evaluating its success, and can also be used to identify areas where research needs to be improved. As part of this research, I was able to, in conjunction with my preceptor, come up with policies for interventions which are aimed at tackling the impact of these diseases on maternal and child health, particularly in these underserved populations. In the bid to complete this research, global strategies also talked about prevention, control, and eradication of these diseases, and the global community has developed several strategies to prevent, control, and eradicate these diseases. Strategies like mass drug administration, integration of veterinary public health services, and new and improved disease management strategies. The WHO has also developed a roadmap for these diseases that emphasizes the need for a comprehensive and cross-sectoral approach to promote clean water, sanitation, and hygiene practices, which we know as the WASH practices, prioritize funding for medical research and universal healthcare, improve the primary healthcare system capabilities to also help with the diagnosis of neglected tropical diseases and their management. Now, the primary healthcare system is at the forefront of disease monitoring. So bringing the need for there to be proper interventions to help push them forward. Now, we also developed a framework for best practices, and it also talks about a synergy between the treatment and health promotion strategies identifying 4 key elements for best practices: pragmatic interventions, multi-sectoral approaches, social ecological models, and defining community. Now, the framework now was inspired by both health promotion and effective neglected tropical disease treatments, emphasizing comprehensive planning and integration, just to see how to reduce the spread of these diseases. As a way to continue this research, we went into this. The discussion part of this research talks about that in the past, health promotion was mainly about getting people to change their individual unhealthy behaviors, such as smoking, eating unhealthy foods, not exercising. But now, health promotion is more widespread and is all about creating an environment where it is easier for people to make healthy choices, including making healthy foods more affordable, more accessible, creating safe places for them to exercise and more places for them to exercise, and also reducing exposure to harmful substances. Now, the World Health Organization has this strategy called Health for All, which is all about creating a world where everyone can live a long and healthy life. This strategy focuses and recognizes that governments have the responsibility to the citizens to create an environment that supports health, and also calls on these governments to provide high quality services that are accessible to everyone. One of the best ways to promote health is to focus on these WASH activities to prevent neglected tropical diseases by reducing exposure to contaminated water and improving personal hygiene. They can also help to improve overall health and well-being. I encountered some limitations in this research. Heterogeneous study design was one major one I encountered. The studies that were included in the literature review were very different from each other in terms of their methodology, demographics, outcome measures, and it made it very difficult to compare the results of different studies directly and draw firm conclusions. For example, some of the studies focused on general populations while others focused on women, while some focused on women and children, while for some just focused on children alone. Now, this made it difficult to know if the interventions that were effective in one population would also be effective in another population. Additionally, some of these studies were conducted more than 5 years ago, so it was possible that some of the interventions that were effective in those studies were no longer effective in the studies that came after those 5 years. There was also the issue of publication bias. The literature tend had this tendency to be biased towards effective treatment or good results, meaning that studies that found positive results were more likely to be published than studies that found negative results. Access to full text papers was also another major limitation in this research. In some cases, it was not possible to get full text access to the papers that were included in the literature review. This made it difficult to fully examine and incorporate some of all of the important research. By way of consolidating this research, we also came up with recommendations. A few recommendations which have been talked about in detail in the study, but to mention them: to improve social determinants of health for mothers and children, to get more organizations involved in addressing these diseases, governmental, non-governmental organizations, to make sure everyone has equitable access to curative and preventive health care, to make sure that high quality care and vector control programs are available in underdeveloped countries. As a way to conclude this study, we're able to see that the study concluded that a long-term strategic approach is needed to fight neglected tropical diseases. This approach should focus on preventing neglected tropical diseases rather than just treating them, and should also involve everyone in the community, including governments, non-profit organizations, and every individual.